Uh, Good afternoon, Natalia. Thank you very much for joining the Arabic team, and we are really happy and honored to have you. And thank you for spending the Friday afternoon with us.
Well, thank you, Zanab, and thank you everyone for joining us tonight. I'm happy to talk about our performance exam, our oral exam, and I'll start with the errors that candidates make during the exam. I've been with CCHI, as some of you may know, from the very beginning. I was one of the founding commissioners, and then I, became the executive director. But in my previous life, before CCHI, I was teaching English interpreting and translation at the Russian University in southern Russia. Then I moved to the United States, and I worked for a refugee resettlement agency in Northern Ohio, and I'm still physically in Northern Ohio. At the agency, I was manager of interpreting, translation, interpreter training, and I did a couple of semesters as an adjunct faculty at Kent State University. Part of my life is teaching interpreters, and then the other part of my life now is establishing standards and developing tests for interpreters. So I'm really excited to share all that I can and what I learned about certification exam. That's what I will start with. I will talk specifically about the oral part of the certification. Then we'll talk about how we interpreters and translators process information compared to other people. I'll talk about the nature of meaning, which is hierarchical, and we'll talk about different types of errors. And I'll end with specifically talking about interpreting errors that happen when you fail to process information correctly. So let me start very briefly about CCHI. We're a national organization that offers valid, credible, and vendor-neutral certification program, and we're the only organization that has its exams accredited through a third party, which is National Commission for Certifying Agencies. And we have two certifications. One is called Core CHI. That's for interpreters whose languages are other than Arabic, Mandarin, and Spanish. They end their certification journey after taking just one exam, the written knowledge exam. But interpreters of Arabic, Mandarin, and Spanish also need to take the oral performance exam, which we call CHI, and then earn their certification. So it's two-step. But we're currently working on developing an English exam that will be also oral, and that will interpreters of all other languages will need to take in addition to the written exam. But that's in the works for the next couple of years. So as far as the numbers we started administering certification exams. First exam was in 2010. So almost 10 and a half years later, you can see our numbers are good, but not too good. And if you look at the languages that are not Spanish, then all Core CHI languages are only a little over 1,000 certified interpreters. But if you look at specifically Arabic, we have 170. So I do hope more and more of Arabic interpreters in this country will take the exam and become a leading language group after Spanish in this area. Now, all the information about CCHI is available on our website, cchicertification.org, and I want you to think of us of the organization that was always virtual. We truly never had an office with the desks and computers. We all work from home. Our commissioners, our staff. We are a small organization, very efficient because we have a lot of things, automated and use technology. So there are three staff persons, me and our registrar and our candidate manager. And then we have a cohort of raters who are also our employees, but they don't deal with candidates other than rating the exams. So our office and our headquarters is our website. So all information that we have is on the website. For candidates, usually you need to start with that button called Get Certified, and then you choose either start here the process, or if you're already certified, then you want to, of course, go to the renewal process. But after you click on the button Start Here for the certification process, you open the area of the website where there are about like 4 or 5 other web pages with tons of information. Now, I also want to encourage you to subscribe and be part of our YouTube channel. Just search for Certification Commission for Healthcare Interpreters. And in the playlist area, you'll see we have different categories, and it was just updated like couple of weeks ago. And so there is a category which right now has 6 videos, which called CCHI Certification Program Information and Exam Tips. And that's the area which will keep adding videos about our exam. But today's presentation is not there yet because I'm still trying to find the format that works best. And I'm really happy to do it for just one language rather than giving examples for all 3 languages. So as far as the oral performance exam, I have on that YouTube channel, you have a special video with the exam interface. So I'm not going to go in detail about the screens and what it looks like. You can go and see that video yourself if you are already at the stage to take the exam. But I will talk about the structure. So there are 4 sections on the exam, and 75% of the exam is dedicated to interpreting consecutively. And that means that when we look at the raw scores of the candidates, they are weighted accordingly, so that the final score, the 75% of the final score, is how well you did on consecutive interpreting. The second section of the exam is simultaneous interpreting, and that one is 14% of the time on the exam and of the score, not the time, the value of the content and on the score of your exam. And then the site translation section is 9%, and the last section is translate healthcare documents, which is a multiple choice, 1 multiple choice question. That's only 2% of your score, and it's a multiple choice question where you need to compare the translations into Arabic and see which one is the correct translation. Now, the exam is computer-based. Everything now is computer-based, but our exam has been computer-based for a long time, since 2012. That's the first year when we started administering Arabic exam. It has 7 oral items, so oral segments that you need to record your interpretation, and as I said, 1 multiple choice question. You have 1 hour, 60 minutes to complete the exam. The exam is timed in terms of for each input, audio input, part of a conversation that you hear, you are allotted so many seconds to record your interpretation. The time between the recording that you think and move from one area to the other, that one is not time. That's up to you. But the actual timing for recording the, let's say, interpreting, good morning, how are you today, Mrs. Smith? Then for this type of phrase, you will be given pretty much 4 seconds to interpret that into Arabic. Now, these timings have been developed based on a group of subject matter experts who are practicing interpreters like you, who, when they were developing the exams, that group, they were asked all to listen and to time themselves interpreting that. And then based on the, there were about, I believe 9 or 11, I don't remember which group, which 9, which was 11 people. So based on their responses, we averaged the time they spent and then added to it, because understanding that the timing should be close to the longest time of the subject matter experts. And then after we did that timing, we run it again through a group of subject matter experts to make sure that the timing works. And that's how we're arriving at the timing. So based on the actual practicing interpreters. And the variations were pretty close, like on some utterances, for example, a couple of subject experts, subject matter experts would spend 8 seconds, but there will be a couple who would spend 20 seconds, right? What we assign for the exam would not be the average of that, but it will be closer to 20 seconds versus 8. So just to give you an idea of the fairness of timing. The testing of the oral exam takes place during specific testing windows because there are a limited number of seats for the exam, and so we want to group them so we can then rate the exams also in a very efficient manner. The exam takes place at a testing center in the United States, administered by our testing company called Prometric. It's done in a private room, so that's already a difference from the written exam, which is in the common room with other people around. So it's really a very safe environment. And currently, regardless of the state you're in, you're required to wear masks if you're taking the exam at the test center, even if your state already is not requiring masks. But we want to make sure that within the buildings of our test centers, the safety protocols are preserved. And the scores are available about 6 to 8 weeks after the last date of the testing window. So you have to wait for it because scoring is done by human raters. And we have several multi-step process to make sure that when we release the scores that they are truly met all the parameters of being correct. So the actual components of the exam are the following. There are 4 consecutive dialogues or vignettes. They're bi-directional and they represent a normal conversation between the doctor and the patient. Then there are 2 simultaneous vignettes. Each they're unidirectional, one from English into Arabic, one from Arabic into English. The simultaneous vignettes are very short. They are roughly between 1.5 to 2 minutes. So it's very different, for example, from court interpreting in this respect, because we understand that in healthcare settings, simultaneous is used in those very short moments, at least until the pandemic started and at least before we started into this area of remote simultaneous being used more widely. But our exam still is, has very short simultaneous. And again, it's usually the speech that is typical for the situations when either a patient or a provider will need simultaneous interpreting. So if you think of when that'll be it, for example, it could be an emergency room, it could be a training sessions to a group of patients if it is from English. And if it's into English, if it's a patient speaking, then there'll be some emotional or emotionally charged speech by a patient, and because you cannot stop them, you have to switch to simultaneous mode. So that's what the content of the simultaneous vignettes are like. And then for the side translation portions, you will see 3 different excerpts, and you'll have to record them separately of from a text in English. And these passages were selected again by subject matter experts from the real documents that are used in different hospitals in the United States. And so the reason there are 3, because they represent 3 different types of documents. Patient education material, there will be a passage about of that type, an institutional form, and a passage from what I call quasi-legal, because in medical field you always have to sign something, right? And so that's because it's an important part of safety issues that the person really understood what they're signing. So one of those passages is related to that. Now, you are getting only 1 score. You're not getting like 3 scores for different passages. You're getting the 1 score, so your performance on all 3 types of the documents will be evaluated. And the testing of the written translation skills, as I already said, is done via multiple choice. So you have a paragraph in English, again, taken from a real document from at some hospital, and then there are 4 Arabic translations, and you need to pick the one that is correct in meaning and mostly represents the form of the original message, because unlike interpreting, written translation has to have both components, right? It needs to be correct and accurate as far as meaning goes, but it also needs to follow the format of the original written text. And And in this respect, if you are thinking of these four components of the exam, when you're getting this score report from us, you actually get the reports on three sections. You reported on how you did on consecutive, how you did on simultaneous, and the last two are combined because we don't really want you to study for the exam in terms of like play the system and know, because if we report this last question separately, then you'll know whether you did it right or wrong, and we cannot, since many people have to retake the exam, we cannot tell them whether they did this one last questions correctly. So these two sections are combined in your score report. Now, how do we score the exam? First of all, I wanted to know that raters do not know anybody's identities. They will work remotely by logging into a platform and listening to one audio at a time. In other words, they're not scoring the whole exam on one person. No, they are randomly assigned one or two, and of course, because it's random, there could be three items from every candidate. And that's why we wait till the exam we have several exams so that the computer could randomize in a better way. And then each audio response, each audio file is scored separately, rated separately by two raters, and they do not see each other's scores, and they do not know your final score ever either. So in other words, we try to make the process as objective as possible, so there could be no bias, because we all know how sometimes, you just like somebody's voice or dislike somebody's voice. Well, because they're listening just to one audio at a time, they have the different voices coming in at different times. If two raters disagree by 1 point, then a third rater is also rating the response, and a formula is combining all these three ratings, because we understand, as put three interpreters in the room and ask them to interpret something, and we'll have three correct variants or maybe three incorrect ones, right? So that's why we want to make sure that we have as much input about your score as possible. And when we review the scores, what we're looking for is that, did the raters rate every item? Did they, were there any errors? How many times did you have to have a third rater? If we need to review that again. The total score is weighted and then scaled to the distribution of points from 300 to 600 points. So the minimum score you will ever see will be 300. The highest obviously is 600. And the passing score is 450. And that's all you need to worry about, because the point of our certification is to say if you're certified or not. We do not share the scores with anyone, and only you see that score. Of course, you could share it if you want to, but it's not about the score, it's about the fact that you passed the exam. That passing point for 50 points is a mathematically adjusted formula after, again, group of subject matter experts evaluated every item and made the decision how much correct information should an entry-level certified interpreter do on that exam. So this process is typical for many certification exams. It's not just for ours, but that's how scoring is done for nurses, for doctors, for other professions. And our psychometricians who work with CCHI have multiple experience of working with other medical professions and some with the court interpreting exams as well. Although I must say that we score the exam differently than court. How so? Each audio response is scored on 4 scales. In other words, raters listen to your audio recording at least 4 times. I mean, many times they listen more because they want to make sure they score you correctly. But the reason there are 4 times is because they need to write down for each of your responses 4 scores. 1 score will be lexical content, and that means how accurately did you convey the original into the other language. It will be about omissions, additions, mistranslations, terminology correctly. We don't count which words you correct. That's not about it. It's about the whole meaning. And so for the dialogue, we're looking at the impact of your interpretation on the speaker. And if the after lexical, your word choices, your additions and omissions may result in the fact that the patient will misunderstand you or the doctor will misunderstand you, that's when you get the non-passing score. And I'll talk about that later because that's the whole point of my second part of presentation. Then we give you a score on your grammar. Again, either English or Arabic, both. And here we're looking for patterns of errors. We all make grammar errors in all the languages, native and non-native, but of course they have different impact. Again, the most critical mistake will be when your logic, your sentence logic is reversed, and I'll give you examples today of that. So then of course you will get a low score on grammar. And then quality of speech, which usually means not the accent, although pronunciation is assessed, but it's more about things like how many times did you backtrack and say, oh, I'm sorry, I mean this, or how many did you guess and all that kind of stuff, which is false starts. How easy it is to understand you for a reasonable person. Now, keep in mind that all our raters actually right now for Arabic are native speakers of Arabic, and English is their second language, like for many of you. So their ear is already trained to hearing your English accent, Arabic English accent. So they're not going to ding you on that because they easier understand you than, for example, a doctor may. So, but if you, the way you speak is too fast, or you chop the sentences in such a way that you could lose the logic of your sentence, then you will get a low score on quality of speech. So again, it's about the understanding of the listener in this case. And I've listened and reviewed some responses where the candidates were just talking fast, 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 and then slow, and then fast, fast, fast. And if you hear that throughout the dialogue several times, then you cannot understand what they're saying at all. Your brain gets tired. And so we understand that the listener will get tired, and that's why you may get a low score of quality of speech. And then the final score, a final score, a rating scale is register. And that I want to spend a little bit more time talking about because I understand that languages are different and concept of register is different in different language. And I want you again to keep in mind that your exam is rated by interpreters who have worked in healthcare by now already over 15 years, and they're still practicing interpreters. They're native Arabic speakers, so you don't need to explain to them that this word in Arabic may be said in 10 words. Before this webinar, I was sharing with Zainab that a couple of years ago, I tried to learn Arabic, and after Sabah al-Khair and Masa al-Khair, it didn't go well, but I do understand that Arabic languages are different than versions of Spanish, for example. And when I try to explain it to my Spanish interpreting friends, I say, think of it like if you're hearing a Portuguese speaker, it sounds like Spanish and you almost get something, but it's really not Spanish. And that's how a Moroccan Arabic and Egyptian Arabic will sound to each other. And that's something that, again, our raters know that. And but I want you to understand what we mean by register. So some definitions. Dialect is a variety of language that is used by a group of people in a specific region or specific social division, right? Usually in the context of, let's say, Spanish, we can say it's a dialect from Mexico. It's a Mexican Spanish, right? Or we can say in Arabic, you probably could say things like Egyptian Spanish, right? Egyptian Arabic or Moroccan Arabic. But I also know that within Egypt, there are different dialects as well. So let's call dialect something that will be, let's say, High Egyptian and Low Egyptian, right? Something like that, Northern, Southern. Now, regional variation is a closer term to what Arabic languages really are, representing different regions, larger geographical locations, or countries. Like, for example, Gulf spoken Arabic. And again, we're talking about spoken Arabic, right? We're not talking classical written, not going there. So we're just talking about the spoken Arabic. And of course, the difficulty with Arabic language is that you also have MSA. And Modern Standard Arabic is this beautiful thing that many countries understand, but it's not a native language for any one of you. And our raters understand that as well. But, and I'll talk about Modern Standard Arabic in a second. Now, there's also, I need you to understand the, especially when you talk about quality of speech, the concept of accent. We all have accents, and it's an element of the dialect. Like if I speak to you in Russian and you are a Russian speaker, you will clearly pick up that my Russian accent is Southern Russian. And the Muscovites and St. Petersburgers will be laughing at me the way I speak my Russian. Now, I also can speak literary Russian very well. I went to the university in Russia, so I do speak good Russian, so to say, but what I would call it educated spoken Russian. So when you're speaking on the exam, because you're not interpreting for a patient, when you speak in Arabic, you really need to speak at an educated Arabic accent, right? So to the extent possible, of course. Now, don't worry about your English accent. As I said, at this moment, at least, we don't have a native English speaker who speaks Arabic as a rater, so their ears are all trained to hear your accent in English. And then register. Register is the level of formality of the language, the formal language that we use in different situations, whether it's formal or informal, right? Today, I'm speaking to you more at what I would say educated spoken English. I'm not going to go into the linguistics and neural language processing terminology, and I'm not going to break it down to third grade level either, right? So this is what, is spoken, educated English like. And so again, my advice to you when you interpret on the exam, again, it's not a real patient, it's exam. You interpret in the educated spoken Arabic of your country, right? In all of your countries, there are universities. When you go to there, you communicate with your professors. That's the Arabic we want to hear on your exam. I know it could be hard because you would be tempted to do it as if you're interpreting for the patient, because you would hear on the exam the accents of different patients, but don't get tricked into it. It's the exam. So our tasks as the interpreter in real life, in the job and on the exam, is to keep the register of the speaker. In other words, if you hear somebody speak something formal in English, you need to interpret it formally into spoken educated Arabic. If you hear the provider making a joke and trying to sound very colloquial, especially if they talk to children, right? Then you could speak it in the spoken street language of your country. But that would be the only difference when the formalities. Your task is not to keep the dialect or accent of the speaker by any means. So when you look in our exam, again, remember, you're listening to a computer and you're recording to a computer, so it's not real life. Don't think of it as real life. When you interpret from English, in other words, you're listening to the doctor's or nurse's words on the exam, you need to interpret into your own dialect as long as you preserve register and correct grammar and preserve all the meaning. And that means 99% of the time that you really would want to use, as I said, spoken, educated spoken Arabic. It could be MSA. If your MSA is very good, then by all means, interpret into MSA, Modern Standard Arabic. But if your MSA is not your strongest point, this is not the time to learn Modern Standard Arabic on the exam. speak in your, Egyptian, Saudi, Lebanese, Moroccan, whichever dialect, whichever version you have, but make sure it's an educated one if the provider's words are formal, especially when you do the site translation of the exam. That's when you are dealing with the written document. In the real life, on the appointment, the doctor and patient and you may negotiate, and you may have to lower the register. On the exam, what we're checking is, are you able to keep the register of this written document? So when you interpret the written document into Arabic, you need to use MSA words or in a terminology or educated spoken Arabic. And then, of course, you do not need to match the dialogue version. For example, we have the dialogues where the patient speaks Iraqi. In Iraqi accent, you don't need to interpret it into Iraqi. We're not trying to. We want to make sure that you understand different accents, but we don't need you to interpret in different accents or dialects. Now, when you interpret on the exam from Arabic, in other words, patient speech in the dialogue of the consecutive items or in the simultaneous, keep in mind that we tried to the extent possible to record it in different regional accents, but in modern standard Arabic, as you understand, to the extent possible, because, the content of our dialogues is not easy to say in modern standard Arabic, because we may have some, child on the situation. It could be a dialect where the child speaks something. So there may be some regional words, but they will be most commonly used. And when we developed the content, we had a group of subject matter experts representing different languages, including Egyptian, Iraqi, Lebanese, Palestinian, Jordanian, and other countries. I have to tell you, we didn't have any Moroccan, and because nobody applied to volunteer for that. So we would love to hear it, but we did have a couple of subject matter experts who spent some time in other countries, including in Morocco. And they ascertained that whatever recordings we produced, they should be understood by any interpreter in the United States who speaks Arabic and interprets in healthcare, because you don't know what patient you're going to get. And so that's why the accents are not the same for every item. Now, I encourage you to practice by taking our free CCHI practice exam. It's located on our training portal called CCHIinterpreters.org. It's a different website, also owned by CCHI, but it's only dedicated to training opportunities. And here we have the sample items. When you click on, like here on this screen, I have only Spanish and Mandarin, but we do have below on the page the Arabic, and it's free. There's describing there that you need to put that code study for you, and you need to use your own recording device, your own phone, to record when you practice. We give their suggestions about the timing too, especially on simultaneous, because you may, simultaneous, especially on site translation, because you'll have the text, and then you will we will tell you your recording should be, let's say, 35 seconds for this particular text, and that will help you understand, are you speaking too slow for the exam or not. Now, let me talk about the second part of this presentation, which is, from my point of view, most interesting. So let's talk about how we process meaning. As you all know, our purpose is to facilitate communication between a patient and a healthcare provider who don't speak the same language. And when we are in the room with these two parties, we all know that each one of us has different focus and different purpose. The purpose and the focus of the patient is to express their feelings, their concerns when they're speaking, and when they're listening, to understand how they're going to be treated, what the treatment will be, right? So sometimes it'll be like my mom, you tell her one thing and she hears another just because she doesn't want to hear me, right? So that's the patient. Now, the doctor, her focus or his focus is get information so they can diagnose the patient and provide the treatment for them. So again, they're not really hearing a lot of things that the patient is saying. They're listening for specific pieces of information. Now, our job is the hardest one because we need to convey each speaker's message faithfully. We don't choose to decide what we want to hear. We don't choose to decide what's important, what's not, because they're the ones who make those decisions. And we're the ones who have to reproduce every meaning that they are saying so they can make their decisions and have communication going. And that's hard because naturally we are all, participators in the communication and not this third artificial neutral party that is just repeating everything. Now, if we need to repeat everything, that means we need to have to have fidelity to the original message, and that requires us to understand the context and the communicative intent. And what it means is that we need to know the healthcare specialty, we need to know what the appointment type is, we need to at least for a second tell ourselves that do you know the provider, do you know the patient, do the patient and provider know each other? Because once I was interpreting like in the middle of a pretty complicated treatment, and I was substituting one interpreter on one appointment, I was thrown in the middle. The provider and patient knew each other, they were talking in shorthand because they knew what they were talking about, and I had no clue. And that was much harder to interpret than if I had been there, and it would have been my 10th appointment as it was for the patient. So that affects your understanding, and that makes your work harder if you don't if you're not familiar with them. But we don't choose, especially if we work remotely. Then the other component is understanding the cultural context, and by the cultural context I mean several things: Western biomedical culture, health culture of the patient, right? Because like, for example, for a Russian, no matter what, you need to have antibiotics. I'm just kidding here, but and you should treat everything with vodka. But patients have their concepts about their culture and what the treatment should be, and that would impact what they actually say and try to say. Now, then you need to really know the culture of the provider and of the patient. And the provider, we're all in the United States, or interpreting for providers who are in the United States, and here you have a variety of things: male, female, races, different hierarchy within healthcare, right? Doctors or surgeons, doctors, pharmacists, nurses, LPNs, RNs. So those all have some different cultures. And then the patients, of course, who come from maybe a country that is not yours, and then you have additional cultural difficulties. Understanding the meaning, and that's kind of is one of the components only, but that's the actual linguistical meaning of the words that the speakers are using. Then chunking and prioritizing the meaning. In other words, you as interpreter need to be able to hear the message, identify key units, secondary units, and tertiary units of information. You're not listening for one thing like the doctor. The doctor is listening like for symptoms, but you, when they started, how severe they are. What you're listening is how many things the person said, how many meanings, what is the most important one, what is the second and third. And then when you start to think about yourself as this person who analyzes the meaning, you need to remember that the meaning has the hierarchy. In other words, some things are important, some things are not. So let's look at this example. And the example I'm taking, we used in the ETOE study last year. So these are examples I will be giving you that are real people interpreting and making mistakes on these things. So not actually interpreting, repeating them in English. So here is the text. You can read it, but I'll read it out for you as well. Endocrine diseases usually result from hyper or hypersecretion of hormones by different glands. A common condition is hypothyroidism with symptoms such as cold, intolerance, weight gain, fatigue, hoarseness, and constipation. Now, if we want to chunk it, what you will discover, and here my red bars showing where the meaning is, you will see that this is a very dense text, and that's normal. In healthcare, every written document usually is full of meanings because it's written. When we speak, we have the fillers, we sometimes repeat ourselves, and it's much easier for that reason to interpret than consecutively or even simultaneously than it is to sight translate, because written texts are full of meanings that you cannot lose. Now, so your first step is to actually identify these meanings. And then your second step becomes to prioritize them. So the question comes, do we interpret all units of meanings every single time? And the answer is yes, of course, right? We're the interpreters, we need to interpret everything. And what I usually say is ideally, interpreter preserves every unit of meaning, and my stress is on the word ideally. But however, we are humans, and all humans make mistakes every day. Now the question becomes, what kind of mistakes? But so in real life, there are factors that force us to drop some units of meanings. Some of them are differences in languages. It doesn't matter that English may have 2 words for something. If Arabic has just 1 word for it, that's the word you will use. You cannot say the same word twice if the English person said, and that's why we're not really counting words when we're interpreting, we're conveying meanings. So that will be already some drop, because if English has 2 words, that means they still differ some way. They're synonyms, but they add something. And in Arabic view or in Russian view, the world is viewed differently, and we only have 1 word for that phenomenon. Interpreters insufficient proficiency in English or in Arabic. I trusted that, at least looking by the names, it seems that you're all native Arabic speakers, but some of you may be heritage speakers. I have a good friend who, was born in this country to a Lebanese family. So her Arabic, I assume, is good enough, but she herself knows that it's not as good as if she was, studied it formally in an Arabic speaking country. She just speaks it at home, and so her Arabic obviously may not be good enough to be an interpreter. Then another factor that would force you to drop units of meaning is unstable interpreting skills. In other words, on a good day, you will do everything 100%. On the exam, when you're stressed out and all the other things considered, you may not perform so well. And for that, unfortunately, the only solution is practice, practice, practice. I mean, fortunately, right? Insufficient time. And that comes hand in hand with unstable interpreting skill. Insufficient time really forces you to drop meaning in real life. And I'll give you an example. It's not like you choose to, I don't have time, I need to go to the appointment. No, that's not what I'm talking about. I'm talking about the situation you're, let's say, in trauma ER, and you have 10 people speaking at the same time at the patient, and none of them really wants the patient to say anything. They're just informing them and commenting as they normally would, and your job is still to interpret everything, but you truly cannot interpret 2 people speaking at the same time or 3 people. You have to choose which one you're interpreting, and you may switch that one person in that context because it's a big organized chaos of providing care in the trauma setting, but you don't have the time to interpret for everybody. And that's what I mean. Insufficient time will force you to choose what meaning you interpret and what you don't. And then
Natalya,
fatigue.
we have 15 minutes.
Okay, and then we have fatigue. And fatigue, that means that you're tired. And when you're tired, I don't know about you, but I cannot, control what comes out of my mouth, and I don't really hear my own errors. And that's, the studies proven that when interpreters are tired, and that was done for conference interpreting, after about 30 minutes, what happens is they think they're interpreting accurately. Well, in fact, they already are not. Now, let's talk about error types. There are 2 kinds that you could make on the exam: interpreting and language proficiency errors. So the language proficiency errors are very simple, right? Something went wrong in the target language, in English, in my case, for this example. For example, the source language, that's what SL means, says, I'm lucky they did not kill me. And the interpreter on the exam says something like, I lucky they not kill me. Obviously, that sentence is not correct English, but our raters actual will not ding you too badly on that because all the meaning is still here. Now, the worst kind of mistakes are interpreting mistakes. When something has gone wrong when you were transferring meaning from one language, from source to target. And here the example is, I'm lucky they did not kill me becomes, I am unlucky they did not kill me, right? The reverse, right? I'm lucky and I'm unlucky. That is already a big error. Now, the difference, in my opinion, between an interpreter and a bilingual speaker, or between a person who fails our exam, at least on the first try, and the second who doesn't, is the types of interpreting errors they make. You could have the errors that are non-critical, and usually, you could allow, get several of them and you still may pass the exam, but you will not pass the exam if you made even one critical error that changes the meaning, that impacts the message and may cause harm to the patient, because that's the ultimate reason for our exam. And when I did an analysis of 40 random exams of candidates, Spanish and Arabic candidates who failed the exams, what we discovered is that they have number one common errors would be wrong word choice, but non-critical. Arabic, and I'll focus on this, had about, on average, out of 40 failed candidates, 8 wrong word choices, wrong lexical choices. 4.8 incorrect English grammar. But the reason they failed is because on average they had between 2 and 3 errors that were critical omissions of information. Then they had some non-critical omissions, and then they had register changes. Now, obviously, when I reviewed these exams, I only reviewed their interpretation into English, and I specifically chose only consecutive. This is the most important part of our exam, and I only chose segments of it, 100 units for, so I can do that comparison. But that just tells you that when you prepare the exam and when you evaluate yourself, you need to pay attention. Do you omit things? Do you process information correctly? Other critical errors, in addition to omissions, were mistranslations, additions, and grammar which changed the logic, and then use of the wrong term. So, but that's, so on average of those 40, randomly selected exams, there were 8 total critical errors, not 1, not 2. So, and if we extrapolate that statistically, that means that all our failing candidates have between 2.8 and 5.9 critical omissions, and that's what makes you fail the exam. Now, what are the reasons? Not understanding the role, because sometimes it almost seems that the interpreter on the exam thought they were interpreting for the real patient, and they tried to do things for the patient and for the providers. Don't do that. You're listening to an audio and you're producing an audio. Make your life easier at the exam, and that will, help you actually in real life as well. Misunderstanding of this source language, or what I call failure to process information, failure to monitor output, and in my opinion, that is what makes it hardest, and what makes the skill of the interpreters really stand out. It's that monitoring your own output, hearing your own errors. I have it with my husband several times, right? I tell him things and he said, I said so. And I said, well, record myself and tell me, and I'll prove to you. But we really need to train our ears to hear what we are saying. Poor memory skills or not taking notes. I do encourage you to take notes when you interpret and on the exam. Insufficient proficiency, and then lack of knowledge of medical terminology. Now, as interpreters, when you're listening or reading the information, you need to have 2 perspectives on it. First is, what is the purpose of the speaker? What is the communicative intent? And the second one is, what is the impact on the patient's health? And then you start creating the hierarchy of meaning. You identify the key points of the message and the units of meaning among those key points. They say there are 5 key points, and that's utterance that the patient said. But in that, you need to identify which of those 5 will affect their health the most if you misinterpret it. And that's where your priority is. So on a bad day, you need to interpret enough that will not affect the patient's health, that will make it safe. That's your minimum goal. And that's the minimum what you can get on the exam. It still won't get you past it, but it'll give you that minimum level. Now, then you need to interpret the secondary important units. So they will not be key. They will not kill the patient, roughly speaking, but they're still important for certified interpreter to interpret. And then there are tertiary meanings. So the 450 passing rate is if you interpreted all key points, including the units of meaning that affects the patient's care, and all secondary points, and made a couple of errors only in the tertiary units of meaning. So truly preparing for the exams, I advise you to analyze the texts. And if we look at our example that I gave first, if I ask you the question which words we can really omit here, which units of meanings, if you really think about it, there's really 2. Usually and by different glance. And I made them different colored because usually is a secondary level. So all the other ones are key points in that paragraph. It's in that, in these 2 sentences. And usually is a secondary unit of meaning because it still tells us that endocrine disease is not always the result, but usually results from hypersecretion of hormones. And then by different glands, that's already tertiary information because it tells us where the hormones are produced, but it doesn't really connect with the rest of the utterance as much. And now let me give you another example. Let's kind of walk through of ranking the units of meaning. Here is the sentences. As I'm reading it, you try to identify which would be the key and which would be secondary and what would be tertiary, and then I'll give you an answer. She has been so congested since yesterday that she can hardly breathe, not to mention sleep. She keeps complaining about dry lips, a scratchy throat, and a horrible taste in her mouth. So the key units are congested, since yesterday, can hardly breathe, not to mention sleep. And again, the word sleep is more important, not to mention, it's like the logic of it. Dry lips, scratchy throat, horrible taste in her mouth. These are the key units. Now, the secondary units are she, especially it may be important if you have 2 people in the room. It could be he, right? A boy and a girl, or 2 kids, for example, keeps complaining because, if somebody doesn't complain about dry lips, that means they're not that dry. If you keep complaining, then it's a harder elevation, symptom. And that's what doctors listening for. They're not listening just for dry lips. They're listening for the severity or scratchy throat, right? But this word keeps complaining will tell the doctor that these are persistent symptoms. That's why it's important information, maybe not key, but secondary information. And then the tertiary is really just the word so. She's so congested, right? Not just congested. So if you're interpreting this into Arabic and want to pass the exam, really you can afford only to drop the word so, and maybe can do something about keeps complaining, but the rest you really have to interpret accurately. So now let me give you an example of what actually candidates did sometimes and why when they fail. So on our ETOE exam, they were asked to paraphrase this text into English. And I picked the candidates who failed also the Spanish or Arabic or Mandarin exams. I'm not telling you which language these candidates were. But so instead of that original first example I gave you about endocrine diseases, this is what the candidate said. Endocrine disease usually results in high or low secretion of hormones by different glands. Now, that's the reverse, because endocrine diseases result from, not in. So they are not the cause. The cause of the endocrine diseases is glands. So somehow the candidate reversed, and that's what I mean by grammar error, when it reverses the logic, and that is a critical error, and that will pretty much everything else is going down the hill if you made that error already in that sentence. A common cause is hypothyroidism with symptoms. And again, a common condition is hypothyroidism. Hypothyroidism does not cause endocrine diseases, right? Again, that's a failure to process information correctly. Hypothyroidism with symptoms such as cold, weight gain, fatigue, hoarseness, and difficulty going to the bathroom. Now, here you may think, well, it's just a register error, but think of it. No, what the candidate did here is it's almost like they were thinking of themselves instead of keeping the fidelity of the message, because they heard the word constipation and in their head it became like, well, usually that means I cannot go to the bathroom. What they're not doing is they're not listening to what the impact will be on the patient, because when the patient hears difficulty going to the bathroom, they will think, oh, I will not be able, I will have difficulty going to the bathroom, both to urinate and to defecate. So, and that is a big change in meaning. So in this short sentence, this particular candidate managed to make 3 critical errors, and this actual 4, because instead of cold intolerance, they kind of didn't hear that, and they said the word cold. Now, the hard part is, or the sad part actually, is that the candidate on this test saw this text. In other words, it's not like it was somewhere away. It was in the screen and they were allowed to just read it. If that's why they still omitted it. So it means to me that, again, something happens to our brains when we're on the exam, when we don't hear what we're saying, because I'm sure the candidate thought they said the cold intolerance. I know they can read it. Now, another example about the congestion. The candidate instead of, this one was different because they had to listen, take notes, they could listen twice, and then they needed to repeat it in English in their own words. And this is what one candidate said. She has been so congested for several weeks, not to mention the dry lips, scratchy throats, and lack of sleep. Well, first of all, for several weeks is nowhere there, right? That's a big change in meaning. And what's omitted is the key part, right? Can hardly breathe. And then secondary, keeps complaining. A key part, terrible, horrible taste in her mouth. Another example, she has been feeling, my daughter, she has been feeling some dry lips, scratchy throat, and she doesn't have any taste in her mouth. She cannot sleep very well due to all these symptoms. So I don't know where the candidate got my daughter. And I noticed that by reviewing the actual exams, including Arabic ones, when candidates fail, is if somebody starts adding things, that most likely means that they feel they're missing something, some information, but they cannot remember what they're missing, and they start filling the air, so to say, with something. Don't do that, because you can, my daughter is no big deal in this case, right? Although when I heard that sentence, I thought it was about the mother, actually, my mom. I was putting myself into that situation. So, but you could add sometimes some serious things that will not do it. And let me and so what she omitted is the word congested completely, right? And since yesterday, can hardly breathe because she omitted congested. So in other words, this candidate managed to completely change the whole sentence because they were not paying attention to every unit of the meaning. And I'm going to give one more example, and then we'll open the question presentation for questions. So on the exam, we had this task when candidates needed just to listen in English, take notes if they wanted, and repeat it. That's all. And individuals who failed both this exam, the English exam, and the Arabic certification exams couldn't do it even for 13 words. And that's pretty bad, my friends, because it's important that interpreters could keep in their short-term memory something up to 30, 35 words, but 13 words, that's very sad. So the original audio was chronic hepatitis C is the leading cause of cirrhosis, liver failure, and cancer. And one candidate said this: chronic hepatitis B is the course for the cirrhosis, liver failure, and cancer. And you obviously know that hepatitis B is not harmful compared to hepatitis C. Those are two different diseases, and the consequences are completely different. Granted that the patient will not know what the doctor said, they only hear the interpreter. That is very serious change. And I'm sure the candidate knows the letters B, C, and A, right? It's not that. It's something that you're not focusing on processing the information, and you're not hearing what you're saying. And of course, chronical is different than chronic, but it's not that critical here. And then another here is the omission of the word leading, because it's not the only cause for cirrhosis, but it's the leading cause for that. And another candidate did worse. They said the leading cause of hepatitis C is liver cancer, sarcoma. That's what I mean when additions could really cost you the exam, because where did she hear that? We're not checking your medical knowledge. We're checking, could you repeat in another language what you just heard on the exam? So, and I think the important thing that, these examples will show you, because, this is that the difference between an interpreter and a bilingual speaker is really the fact that how we process the information, and we value each unit of meaning, and we look at it from two perspectives: what the speaker wanted to say, and what would be the impact on the patient's health if we omit some of the information. And with that, thank you very much, and let's go to questions.
Thank you a lot, Natalia. I'm sorry I had to rush you, but
No, I wanted to be on time, and I'm glad that.
I know,
Thank you.
and we really loved everything. And thank you all for being patient and not interrupting and listening. And now it's your time to talk, but let's take turns. I have few questions. I'm gonna read from the chat, or if you wanna read it by yourself. Let's see who first. Let's see. I remember Sira was the first one, but she said it's already been answered. And somebody asked if there will be a recording. We do our
sorry,
best.
Zainab.
Yes.
Zainab Sira. So
Okay.
the second question was answered. If we can get an answer regarding the repetition of the utterances, and
can you please ask it again?
So my question is, we can use the repetition for the utterances in the consecutive interpretation on the test. And my concern is, will any points be deducted? I do understand that
there is no point. No points are deducted. You can repeat everything. You just need to mind the time, because
the time management.
Yes, but we don't really, although, because it's a computer exam, all your clicks are recorded, but raters don't see that. Raters are only listening to your audio recording. And I would advise, if it is something simple like thank you, then don't worry about it. Don't replay it. But if it is something you didn't understand, and then another thing with the any consecutive or simul, when you're listening to it, if there are some names or numbers, write them down, because from a personal perspective, I always mix the numbers 6 and 7. I don't know why. I mean, I seriously, like, I reverse them, and it's like on a daily basis. So I always write down what I hear, so I don't have to remember it. So it's important that you replay, especially if you couldn't remember for some reason, what was the order or something. Now, the other thing
especially
is,
in Arabic. In Arabic, we have to flip the numbers.
I know.
In English, from the second digit the first. In Arabic, we start from the first to the second, and that will confuse a lot of people, especially
Yeah,
me.
so write down the numbers. I don't think we have that many. I think we maybe have 1 or 2 items which have the numbers, and they're very simple numbers. But write those down. Yep.
We have Manal. She had a question. You want to ask it, Manal? Arif? I will read. The time at the exam is very short. It's extremely unrealistic. We need realistic. Sorry, we never interpret this fast in real life. Please consider adjusting.
Well, and that's why I explained
Right.
to you that, we had a group of interpreters who are practicing right now, right? And they did the timing. And when, again, we selected the timing, it was on the, giving the cushion to make sure that you can do it. So the part of the standard is takes into account the language. For example, actually, let me say if I'm saying it correctly, the Arabic timing is longer than Spanish. And I think it's even longer than Mandarin because of the way the language is constructed. But I definitely know that the timing for Arabic is longer, for Arabic, some Arabic utterances is longer than for Spanish. Now, overall, when we add everything up, the difference between Mandarin and Spanish exams and Arabic exams is only within 1 minute. But with each, like, for example, shukran, right, is 2 seconds, no matter what language you're saying, that is thank you, right? But certain utterances are longer in Arabic than they would be in Spanish or in Mandarin. So timing, unfortunately, is part of and speed is part of your performance, and that's something that was established, and we just got the content updated, and there different timings there. So maybe, what I suggest to candidates, especially if it is the first time you as an adult are taking an exam, is don't judge yourself if you failed it once or twice, right? Because it takes time to get used to the fact that you will be timed. In real life, you are not. But that will give you the idea of how fast you need to be for the exam.
Thank you. And we have Salma Sukkar. You want to ask a question, Salma?
Yeah, hi, Natalia. Thank you so much for this presentation. Actually, you already answered my question, which is the mistakes that the Arabs make and why we have such a low rate of passing the first time. But I did have another question. So basically, when you start the exam, from the moment you start press, you press and then you're starting the exam, it's the whole thing from beginning to end is an hour, correct?
That's right. So there's several that, like, on the computer, the way the computer thinks, there are 3 sections. First section is when you read the introductions and instructions, and it allots you 15 minutes to that. If you've heard this presentation, read the stuff on the website, you don't need that 15 minutes, but that 15 minutes is not counted towards the exam, right? Then the second part, what the computer thinks is the second part, is the actual exam, and that section is 60 minutes. So as far as the ability to, if you just listen to the recordings, and difficult ones you will listen twice, and you record yourself, you should be done within 40 minutes. The 20 minutes is really for you to think between the recordings. And what I advise also everyone is, you heard it's a consecutive utterance. Don't rush to click record right away. First, think what you say, then click record, and then start saying it. Now, for simultaneous, there's only one button. You click it, and within 5-10 seconds, you need to start interpreting, even though we do add the time at the end to that. Let's say a recording itself is 90 seconds, then you would probably get, depending on the content, about maybe 100 seconds to or 115 seconds to finish that. So that one is different. And the side translation, it's obviously you're reading the paragraph. So again, it's you judging how much time you need to process information, but the recording will be either like 35 seconds, 47, 60 seconds. They're different depending on the passages and difficulty of those passages. But so that's 60 seconds, and you control how many times you play, how long you think in between clicking. And then the third section, what the computer thinks is the third section, is the survey that is voluntary. You don't have to answer it at all. You can just click no and you click the top button, finish the exam, and you're done. When you are ready, when you are looking at the timer, even though it says section whatever, that's the timer that shows you 60 minutes for that main exam section, and then 5 minutes for the third section, which is the survey.
One
Thank
more.
you. We have Fatima.
Oh, okay.
Do you want to ask your question, Fatima? Should I read it? Okay, Fatima is saying I'm Moroccan, but I am more comfortable interpreting Arabic standards. Can I use it in the oral exam?
Absolutely. If you use Arabic standard, that's perfect. It's if that's what you're doing, because again, the difficulty with Moroccan and some other Northern African Arabics, if you can say Arabics in the plural, Arabic languages, will be the fact that sometimes it's hard when you are on the exam to determine, do you keep the formality as at the same level as the English formality was. If you're interpreting in modern standard Arabic, then you're formal right away. So you don't have that in your head. Should I use this word or that word? There is, in modern standard, there will be only one word to use. So that's why I think if you're really studied it, if you're trained in it, then especially for terminology, and that's advice for me for everyone, for terminology, even if the terminology is the word heart or blood pressure, don't sweat it. Use modern standard Arabic, because even though, it doesn't, really, you don't get brownie points for any specific dialect, but it's just psychologically, because modern standard Arabic is formal, it would make the quality of your score probably higher. Again, I'm not an Arabic speaking, I just read about it, but that's what I think.
Yeah, we have one more as far as I see. Oday, would you like to ask a question, Mr. Oday?
Do you need to, I like this one. Do you need to express emotion? Yes, please. Because thank you actually for these questions. I forgot to mention about the quality of speech. One of the parameters where you could get a lower score if you don't match the emotion or intonation of the original speaker. In other words, especially like on the simultaneous, if you are having somebody very emotional and you're interpreting wah, 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 then you could get a lower score on the quality of speech. And your score for each item is a combination of those 4 scores, right? So you want to get your highest points on every, like lexical content, grammar, register, and quality of speech. So emotion and intonation, that would affect, may not affect too much, but it might. We did have one person who got a low score on one vignette because she was rushing. Was a dialogue, and the dialogue was kind of nice and measured. Dr. Ask expresses like empathy, and she was like very fast and very, like all one tone. And they decided like it was so distracting. That tone was too distracting to get the words that she was saying. Like the doctor would say something, "I'm so sorry for your loss," for example, and it will be sounding like very fast and very, lively. That would be a mismatch of the words and the intonation. And I know it's because of the nerves. Again, we all understand, but the exam, is the point where you show that you stably can reproduce the intent and the meaning of the speaker, and the meaning sometimes is in the emotion. So thank you very much for that question.
Okay, we have 2 people who would like to ask, I think Isra and then Raja. If you can raise your hand, that will make it easy for me, so I know that you need to speak.
And I can
we
also
have 10
see this
minutes.
Salma's question, and that question is, what is the longest utterances? Yes, 35 words is, the longest utterance on the consecutive exam is 35 words, including the like the, is, very short words. So we don't have any utterance that is longer than that. So it's really very short utterances. Now, the 35-second segment, it probably would be typical more for a site translation, and our site translation is usually 3 sentences and I think the longest is about 45 words because it's a written text. It's 45. So again, I'm talking about reasonable number of words compared to the seconds.
Yeah.
The speech, we did the standard speech speed for both languages. That's the other way of how timing was determined. So Google it, whatever is the standard speech. So, and go into the, not the middle, I think it's a range, like let's say between 115 and 125. So go into the middle and then add 5. That's what would we consider the speed that would be normal.
Okay, thank you. Isra, you can ask a question.
Yeah, thank you. I think Natalia already answered my question, and it was yeah, it was about mentioning. She did mention something that the speed or speaking too fast may work against the interpreter and the
Yes.
interpretation.
Okay,
And
thank you.
yeah, and I think
Okay.
it's also because of the nerves, and it's also because of the fear that you may lose time when you, and then you like you may.
Yeah, you may not
Run
have
out
enough
of
time. Yeah.
Exactly.
Yeah, no.
So please take this into consideration.
No, I mean, we
when
do.
break.
And the good thing is, I want to tell you that the raters do not count the errors. They're looking at the impact. And so that's why, for example, you can, I mean, let's say you can omit some words and it will not affect your score. But if you omit the word that is meaningful to the patient and will, affect their, understanding it, that's when you are losing things. And I also have a question here. See, do you have complicated medical terminology? No, not really. All the level of the language is what we consider the normal conversation between the doctor and the patient. And even these written passages for sight translation would be the most common ones. In other words, you won't have their procedures which have never been seen yet in the educational. There will be all the normal things that you'll see on a daily basis working as an interpreter. So I would think more about the words like, take a look at our glossaries on CCHI's website, and you will be able to get an idea of what it is like, and take that practice exam, because that'll give you a good idea of what the difficulty level of the vocabulary is.
Okay, great. Thank you very much. Anybody else have a question? You can unmute yourself. We only have a few minutes left. And I hope we answered all the questions in the chat. For those who took the test on February 10, when will the result be out?
Next week. I don't know if it'll be Monday or Tuesday, but it will be one of those days. At least that's what I'm told today.
That means like Saturday, Sunday, and next Monday? Or
oh no, I'm taking about 22nd or 23rd.
Okay.
That's what I was saying. I would just finish the quality assurance this afternoon. I was told, and so it's going to, you're first getting the score report, and then you get the official score from CCHI. Now, on the screen, as you see, is the email, and you think that this is like generic email that doesn't mean anything. info@cchicertification.org. As I remember, I said in the beginning, there are only 3 staff people. So this goes to candidate manager, Eddie Al-Nadi, who actually coincidentally is an Arabic speaker. So what Eddie does is he monitors this email and responds it. And if he cannot answer the question, then he forwards it to me or to our registrar, Yami. So the 3 of us work very closely. So the fastest way to reach me is through that email, because if it's something that either is testing related or application related, then they will fix it faster than I do, because they do it daily. I do it like once a month. And so I may take longer. But secondly, if they cannot answer it, they forward it to me. And I always answer their emails first, because I know they escalate things that are important. So don't hesitate to ask questions. Also, when you receive your score reports, I wanted to show you actually a web page. Let me get to the website very quickly, where we explain the scoring a little bit more. So you go to the website. This is homepage. From the menu. Now, from the menu, do the search for the word score. And here you have the link to the page CHI exam score. And here is the whole web page. Read it. It has some stuff from our psychometrician who explains different things, how to read the score, what's equating, etc. Because certifications exams are different than college exams. They need to take into account that they are standardized, that they, take into account what the subject matter set as a passing score with that 450%. They take into account different formulas, how to adjust that different items have different difficulty. So as a certifying entity, we do not disclose that. That's our trade secret, so to say. But we do provide this explanation so that you know that it's not arbitrary and it truly is following the psychometric procedures. But if it's still not clear, ask us and we will, clarify again how
I told
we can
Natalya earlier, this was one of the most organized exam, and I really like the way it was conducted. We have Yumna Jamal, if you like to ask.
Thank you. I'm sorry I tuned in late because the all events and my Google Calendar didn't put into consideration that time moved back an hour. So unfortunately, I missed most of the session, and I'm not sure if this was asked before. But my question is the CHI exam available outside of the US for interpreters who are serving the US market?
Unfortunately, you asked a very well. Depending on what you mean by outside the US, we work with a company called Prometric, and so they do have test centers across the world. However, we as an organization are limiting our exams only to Northern America. So it is United States, Canada, and Puerto Rico. That's where you can take the oral exam. The written exam, the first part of the certification, that CCHI exam, that one is available online, and that one pretty much anybody could take from across the world. But the oral exam has to be in the test center because of the nature of it, of the audio nature of it. So, and nobody asked that question, so you joined and you asked a very good question. Thank you, Yoma.
Oh, that's great.
Thank you.
For the written, is it only in the pandemic or it's going to be forever like this?
Well, never say never, right?
Okay.
I never say forever. So, right, let me say what we say. If you go to, get certified, start here online testing, and the word we're saying is, we're not saying. Right now, we are evaluating this opportunity on a 6-month basis. So that's all I can say. We started in January. So in 6 months, we'll evaluate and we'll see if we're continuing it. The technology is improving all the time. We already see a tremendous improvement this now compared to how we delivered it in August. That's when we stopped. There was a change done, a transfer to platform. So it seems to be more stable and better quality. So in 6 months, if we're satisfied with the quality, then we will continue. If not, we will see how the pandemic is, etc. So our goal is to, make it as accessible as possible. But if the technology is not cooperating, then we would rather save our reputation and our own resources for something else. But
okay. Thank you very much. And Yumna, we have this recorded. I hope you can see it later. Selma, that's the last question. So please go ahead, ask your questions, and we have to end this session. We don't want to take too much time of Natalya's afternoon.
I'm sorry. Yeah, I think it's more the nerves. So apologies if we're throwing it at you. So basically, when we finish the exam, do you recommend that we keep studying for the exam in case we fail it so that we can take it in the next window? Or do we just relax a little bit? What's your take on that? Because I hear many people do that.
It's a tough one, right? It depends on what motivates you, right? With me personally, I know if I fail something, I am much better next time than if I sailed through that. I don't value things that come easy to me, but I would suggest you, you can take it easy in terms of getting your score report and looking at what it says, because you want to see how far you and how well you did if you failed. Consecutive interpreting, you will see, for example, let's say 75%. What it means that out of a full score that you could have gotten on consecutive, which is 100%, you did at 75%. 75% is good, but you don't have any cushion there. It may not be good enough to pass the whole exam, right? Then on simultaneous, let's say you got 64%. Well, that's already a little bit, it's not bad for simultaneous because it's only, remember, 14% of the whole score. But overall, if you think roughly of any exam ever created by anybody, and again, I cannot tell you our proprietary percentages and formula, but if you think of any exam, you usually see the 75%, 80, 85%, right? That's kind of is expected how much you need to answer correctly. And you look at your site translation and you see it's 91%, right? So what you can do when you get that score report, you will think like, all right, it seems like site translation, I'm not too bad. I got solid 91%, but the other two are not too good, because with this score I gave you just example, I honestly don't know. You could be 449 or you could be 450 with these percentages, right? Or you could be 444. I don't admit, each form is different. Its language is slightly, each form is different. So what these percentages are telling you what you need to study next more. You still need to study for everything, obviously, because with the skills like simultaneous, if you stop doing simultaneous, you are losing it. And nowadays, with the remote simultaneous platforms becoming all the rage, we hear it from hospitals, from doctors, from telehealth, that's how they want us to work, right? So I'm predicting like in the next 5 years, we pretty much, no matter how we like it or not, we will be required to do remote simultaneous in medical setting at least half the time. So that's why, I would continue preparing, practicing your simultaneous because it's the easiest to lose, but I will wait for the score report to see how you did on consecutive and the site, so you can assess what you need more, written language from English into Arabic, or do you need to just, both, which is consecutive. I can
Great.
talk about it forever, but it is about almost 10 o'clock here on the East Coast.
We really, really, really appreciate you coming and spending the time with us this afternoon, and it's Friday. So thank you all for being such a great listener and giving us all the time to let Natalya tell us more information, because we really need it. And thank you, Natalya, for spending the afternoon with us and for giving us all those precious information. We really, really appreciate you being with us. I'm going to end the recording right now.